Hi, my name is Benjamin Linson, and today I'm going to do the cluster of Wainner. The cluster of Wainner is to exclude cervical radiculopathy in patients because of its high sensitivity. Cervical radiculopathy is a red flag, so if the patient has it, then you aren't allowed to perform manual therapy on them in the cervical area. The first test of the cluster of Wainner is the active cervical rotation, and that's with the patient. This patient has, let's just say, has pain on her right side, and so the active cervical rotation would be towards the right side, and you're going to ask the patient to sit up straight and to perform a rotation to the right side. How do you feel?
Good.
Right. If there is pain, this test is to provoke pain, and if there is pain that's similar to the same as referred pain to patients that have cervical radiculopathy, then it is a positive test, as well as you're also looking for limitation at 60 degrees of rotation. The second test is a Sperling's test. It is also a provocative test, which you compress the cervical vertical column. This is also a progressive test, so the first is to compress it while the patient is sitting up straight, to compress the head straight down. Is there any pain?
No.
No? If there isn't pain, then you move on to extension, a little bit of 10 degrees extension, and you compress. Is there any pain?
No.
No. And then you progress to extension with lateral flexion. And you compress. Is there any pain?
No.
You are looking for pain, and with the similar symptoms, if there is pain, then it is a positive test. And the third test of the cluster van Wainner is the distraction test. So if the patient can lie with their head and their back on the table. Great. To start off this test, you are going to place your hands underneath the patient's occiput. You're going to have most of your fingers by the mastoid process, and you're going to add a little high cervical flexion, and you're going to pull away. How do you feel?
Good.
That's good. And you are looking for relief of symptoms, as during the distraction you are creating more space in the foramen, and so there will be a less symptom involvement. If so, then that is a positive test. And the fourth test for the cluster of Wainner is the upper limb tension test. The upper limb tension test is used to assess the mobility and integrity of the nervus medialis, at least for the upper limb tension test 1. And how to perform it is you depress the shoulder girdle of the patient. You take the patient's shoulder into 90 degrees. You externally rotate the humerus, and then you extend the fingers and the wrists, and then you bring the patient's elbow into extension, and you mark the degree of which the symptoms are provoked, which is around here for the patient, which is 10 degrees. Usually patients with cervical radiculopathy have it around 90 to 80 degrees of flexion. If 4 out of the 4 tests are positive, then there's a 90% chance of cervical radiculopathy. And that was a cluster of Wainner. Thank you.